The United States and Brazil lead the world with the highest number of coronavirus cases. The U.S. now topping 3 million infections. Just what's behind this surge? Hello, I'm Mike Walter filling in for Anna Naidu, and this is The Heat. The United States set a single-day record on Tuesday with more than 60,000 new COVID-19 cases. Hospitalizations are on the rise from Arizona to Florida. And come November, new modeling projects the death toll could rise to over 200,000 if people fail to wear masks. The World Health Organization reiterated no country is safe and no individual is safe. That became clear this week when Brazil's President Jair Bolsonaro announced he had tested positive for COVID-19 after repeatedly denying the seriousness of this pandemic. U.S. President Donald Trump is calling for all schools to reopen in the fall, a sentiment echoed by the White House Coronavirus Task Force at a briefing on Wednesday. We begin our coverage with CGTN's Jim Spellman. He's at the White House. And Jim, the United States hit a grim benchmark on Wednesday, surpassing 3 million infections. Why is the Trump administration pushing so hard right now for schools to reopen in the coming weeks?
Well, the Trump administration argues that physically reopening schools for in-person education is essential for what they call the holistic health of American children. That means the educational needs of children, but also the socialization needs of children. And they argue that the death rates here in the U.S. of COVID-19 are not rising the same way that cases are. Here's a little of what Vice President Mike Pence said earlier Wednesday.
Our mission here is to safely reopen our schools. And as you've heard from all of these members of our task force, it's not just about kids learning and not falling behind academically. It's about all the vital services that children receive at our schools. It's about working families. It's about opening up America again.
This is essentially, though, about the U.S. economy. American families, the parents can't go back to work if their kids can't go back to school. So that's one of the things that's driving this push here. Public health officials warn, though, that if children go back and too quickly, that the right precautions aren't in place, that this will simply lead to more cases. The children themselves may not be that vulnerable, but you have teachers and staff, and the children can spread it throughout the community. President Donald Trump, though, threatening to hold back education funding for schools that don't reopening. He's also attacked his own CDC, Centers for Disease Control, going after their guidelines for schools to reopen. The CDC now says that they will revise those recommendations. Mike?
So new flashpoint. Jim, also the U.S. president hosting the Mexican president at the White House. There's been some controversy surrounding this visit as well. What can you tell us?
Yeah, so the main points of this visit are to mark the implementation of the USMCA, the U.S.-Mexico-Canada trade agreement that went into effect last week. The United States is Mexico's largest export market, and Mexico is the second biggest trading partner for the United States. So this is a key financial, economic relationship, but really it's also a chance for both presidents to look presidential on the world stage in the middle of this crisis. Both of these men say this is a good relationship. President Trump likes this relationship because President Lopez Obrador has been reluctant to publicly criticize President Trump over his controversial immigration stances that many of these critics argue are racist. Mike?
Jim Spellman at the White House. Thanks so much. He leads off our coverage here. For more on how COVID-19 is impacting the United States and Brazil, let's bring in our panel now. Joining us now from Brazil is Gustavo Ribeiro. He is the founder of the Brazilian Report. Also with us in Washington, D.C. is Anya Prusa. She is a senior associate with the Brazil Institute at the Wilson Center. And from Phoenix, Arizona, Will Humble is the executive director of the Arizona Public Health Association. Coming to us from California, Dr. Rishi Desai. He's the chief medical officer with the health education platform osmosis.org. Welcome to the show, all of you. Dr. Desai, why don't I begin with you? Because, we're talking about some rather mind-boggling numbers. 3 million cases, 132,000 people dying here in the United States, and then we're seeing these spikes all over the place, including in your state in California. Explain why this is happening.
Well, I think the bottom line is that a lot of states were getting fatigued with shutting down and basically got tired of it, and so they opened up too quickly, and now we're seeing the aftermath of that. One thing that I think is confusing for folks is that the cases rise and then the hospitalizations rise a couple weeks later, and then deaths rise a couple weeks after that. So, you know, I think that math befuddles people because they see the cases rise and say, well, you know, the deaths haven't risen yet. But you have to remember it takes a couple of weeks for people to get sick and then eventually die. So it's sort of a canary in the coal mine, and we should look at that as a forewarning. And as the cases rise, as California is doing, we need to shut back down again.
Isn't another problem, I was just having a conversation with somebody in my neighborhood doing social distancing, and I was mentioning to this woman that I know of at least 10 people who've gotten COVID-19. She doesn't know anybody. Isn't that also a problem? Like, a lot of people are going around, they don't know anybody that's got it, they're just seeing it on the news, it's not really affecting me or my friends. Isn't that one of also the problems out there?
100%. You're absolutely right. You know, this is affecting poor communities much more than richer communities. This is affecting essential workers, which are basically people that have no choice but to go out and work in jobs that require their physical presence. A lot of richer communities have people that can work from home. And so it's those individuals that are essential workers for our economy that are coming from poorer communities that are most hard hit. And as a result, a lot of folks that come from other richer communities say, you know what, I think this is overblown, I'm not seeing it. So you're absolutely right about that.
I want to get to the other panelists, but I want to ask you one more question about California before I do, because they reported 10,000 cases on Tuesday, a record for a single day. And, you know, California was applauded for really Governor Newsom hitting the brakes early. Did he just hit the gas too soon? Is this another example of just starting up way too soon? Maybe you should have held back.
You know, I think that it's both leadership and also the people. So, for example, you know, there was a lot of public health messaging about social distancing. The moment that they allowed people to go outside to beaches, the beaches were crowded. You saw people going to bars and clubs and cafes and restaurants and sort of acting very maybe overconfident. There's a lot of bravado, like, oh, we've gotten over this. And that was very false. I think people don't realize this is a marathon, not a sprint, and we got burned by it pretty bad.
And Will, there in Phoenix, you've got the mayor saying there's a dire situation right now. There are reportedly just 200 ICU beds left for the entire state. Give us your feel of how things look in Arizona at this stage.
So we got a couple of problems. Number one is the real crisis problem, which is the lack of hospital capacity given the number of cases that have been coming into our hospital systems. We've got some parts of the state that are transferring patients to other parts of the state where there are still a few beds, but we've got a long way to go. And what's happening here is the hospitals are implementing their surge plans now. So they're hiring as many intensive care unit trained nurses as they possibly can from other parts of this, from other states, and just trying to staff up. There's also something happening here called, we're implementing what's called the crisis standards of care, and that's in preparation for the moment when our surge capacity is inadequate to really treat people with what's called here the regular standard of care. And essentially that's a system whereby you triage individual patients and then provide the treatment for those patients that you believe will most likely benefit from that. So that's the urgent situation right here, is just trying to deal with the influx of patients, much like what New York saw a couple of months ago. The other side of this is to try to get a handle on the prevention side, which is to try to prevent the pipeline of new patients that are coming in. And so our governor last week implemented some, I would call them half measures, where at least nightclubs are now closed for the next 3.5 weeks, and see where it goes from there. But much like what was described in California, what happened here is that when the stay-at-home order ended on May 15th, it ended with a bang. And really, it wasn't a phased-in reopening. It was a total reopening. And I think that's the issue here, is I don't really have a problem with opening on May 15th, in Arizona. My issue is the way we did it was that it was not smart, it wasn't phased, and it was an all-in sort of approach, and we're dealing with those consequences right now.
And Governor Doug Ducey, if I remember correctly, told people, go out, go to the restaurants, everything's okay. Clearly, that's not the case right now. But to get back to your issue, you were talking about triage. It brings to mind what happened in Italy, where there's this basically a tsunami of patients coming in, and doctors have to really start to make these kind of life and death calls. That can be traumatic for the people in the healthcare industry as well.
Well, nobody goes into medicine, whether you're an ICU nurse or a physician, nobody goes into it thinking that they're going to be implementing crisis standards of care. In other words, that they're going to be making life and death decisions about who gets treatment and who doesn't. You know, a lot of that, when family members have advanced directives and those sorts of things, doctors carry those out, and it's within it's the wishes of the patient. But in this case, they'll be making decisions to withhold treatment from people because it's not available. And it's not the patient's wishes, it's not the family member's wishes, it's what they have to do just by virtue of the fact that they don't have the resources on hand to treat all the patients. Now, I want to emphasize that we are not at that threshold yet. It's been authorized by the state government because all indicators are pointing to the fact that at some point in mid-July, this is what will be happening in Arizona.
Well, let's talk about resources on the front end, too, because testing continues to be a big problem in the United States. It's a big problem in Arizona. I heard the mayor of Phoenix talking about people waiting for 8 hours. They've got their cars on so that the AC can be on because it's so hot there. Some people running out of gas. What's the issue there? Because we do remember the President of the United States not too long ago saying, if you want a test, you can get a test. It's that easy.
So what's happening here in Arizona is the following, is that, the number of absolute tests has been increasing over the last month. That's true. There's a lot more testing that's going on today than there was 3 or 4 weeks ago. The issue is that the community spread has just exploded in an exponential way. And so even though testing has increased, the demand for that testing has increased much faster. And that's what a shortage is. It's supply versus demand. And so the demand is much greater than the supply. And one of the things that you see are these big lines, which you probably have some footage of, where cars are, at one point there was a 13-hour wait in people's cars outside of a testing facility. But that's not our only problem with testing. The other issue is, and I'd argue that it's even a bigger problem, is that the turnaround time for those tests has been 6, 7, 8, sometimes even 14 days.
Wow.
And so the value of testing is when it's immediate. That's when it provides actionable information. When you get a test result 8 days later, number one, it doesn't have any clinical value for you. Number two, your contact tracers don't have the information in time to do the case investigations and to get people into isolation and quarantine. So you're hamstringing yourself with respect to your contact tracing as well. So both of those things are things that need to get straightened out in short order here in Arizona.
Yeah, some real issues there. Gustavo, let's turn to Brazil. We did hear Jair Bolsonaro, who really downplayed the coronavirus, admitting just the other day he has COVID-19. Let's hear what he had to say about his health.
I am fine. I'm really fine. I'm even feeling like going for a walk. I'm not going to do it now only because doctors say I shouldn't. I credit this not only to the fantastic care I had from my doctors, but also to the use of hydroxychloroquine. The reaction was almost instantaneous. In a few hours, I was really feeling fine.
And Gustavo, right after that, those comments, he took his mask off. This is a man who's really been adverse to wearing a mask. He's dove into crowds, shaking hands, doing all of this. Talk to us a little bit about that, and do you think this is going to have any kind of impact moving forward?
I don't expect Jair Bolsonaro to pull a Boris Johnson and moderate. He used his announcement as an opportunity to double down on every single talking point he has used since the beginning of the pandemic, that is saying that social isolation is useless because almost all of us are going to get infected at some point, trashing governors for enacting quarantine measures that he says are the sole responsible for Brazil's economic crisis. He has touted hydroxychloroquine, as we have just heard, once again, saying that he doesn't look ill because he uses this anti-malarial drug with no proven efficacy against COVID-19. And like you said, he has avoided using masks. He has met with dozens of people, including the U.S. ambassador this past week. Several times he didn't wear a mask, and it gets worse. We at the Brazilian Report have talked to several public servants within the federal administration, and many of them complain that they have been peer pressured to not wear masks within public facilities because the president says it is a testament of his manhood not to protect himself, and several of his underlings think like him. So there has been several complaints to public servant unions that the government has simply not provided the basic instruments for servants to protect himself. So not only Jair Bolsonaro is threatening people he has immediate contact with, but he's also putting at risk the lives of at least 3,500,000 public servants within the president's branch of government.
Is it going to be a jarring impact, though, on his followers? You know, we hear here in the United States, Donald Trump, and mirrored really much by Jair Bolsonaro. This is fake news. It's not that big a deal. It's a little flu. Is this going to have any impact on his supporters? Will it be jarring to them that suddenly he actually has the coronavirus?
Well, what the president does has a strong effect on millions of people, at least 1/3 of the Brazilian electorate. So Bolsonaro and his followers want to use this diagnosis as an opportunity to say that if he beats the virus unscathed, that he would be the living proof that the coronavirus is nothing more than a little flu. That's how he has called COVID-19 on multiple occasions. And we have created an environment of toxicity in Brazilian politics that on one hand, on one side, you have these people that say Bolsonaro will prove that there's nothing to worry about. On the other side, you have people who don't even believe he has caught the coronavirus, because after a trip to Mar-a-Lago to meet with Donald Trump, several aides of the president fell ill and contracted the coronavirus. The president took 3 tests under aliases and hid the results for 2 months. It took the Supreme Court to intervene for him to make the results public. And now he has been more straightforward and has presented the test results under his own name. And people say, well, if he acted the way he acted in March, why should we believe him right now? So we had even the biggest newspaper in Brazil, to give you an idea of how bad things are politically here, that ran an op-ed by a prominent columnist that said that he hopes Bolsonaro will die, and that will serve as a cautionary tale to all COVID-19 denialists.
Jeez. Well, Anya, let me talk about some of the other patients in Brazil, because right now there's about 1.6 million cases in Brazil. We have upwards of 66,000 people who have died. Some epidemiologists actually predicting that Brazil could leapfrog the United States and have more deaths by the end of this month. Give us the lay of the land. What does it look like in Brazil? Just how dire are situations there?
Well, the issue in Brazil is that the government really does not have this epidemic under control. So what we're seeing is that cases are increasing. Cases doubled in the month of June, and we're seeing that the rate of transmission has actually ticked upwards in the latest figures from the Ministry of Health. So it is clear that this will continue to be a problem and that we are going to continue seeing these numbers rising. And we're seeing that the places that the disease is spreading, it's now across Brazil, right? So when COVID-19 first entered Brazil, it was in the cities. It was with people who had traveled perhaps from Italy or China or elsewhere who were bringing these diseases into the urban areas. And what we've seen over the last month or two is that the disease is now spreading into the interior. It's spreading into more rural regions, into the border states. And these are often areas that lack the health infrastructure necessary. They have fewer hospitals, fewer beds, fewer ventilators. They lack the financial resources to address this disease. So it's incredibly concerning to see that it is spreading and to see that there is not a coordinated effort being led by the federal government to actually control the spread.
And as a follow-up to you, Bolsonaro on Wednesday vetoing provisions of a law that obligated the federal government to provide drinking water, disinfectants, and a guarantee of hospital beds to indigenous communities, which have been hit hard. How badly are they going to be suffering as a result of that, do you think?
Well, I think it's an incredibly concerning issue. Again, you know, many of these communities live in more rural areas. They live in states, including in the Amazon, where, again, there are not a lot of hospital beds, where there might not be access to easy running water. And so the fact that the government, that the president is vetoing this bill, I mean, it's a sign in many respects of his continued insistence that this disease is not a serious threat to Brazil and to Brazilians.
Dr. Desai, the United States just celebrating another holiday, the 4th of July, Independence Day here. You saw, again, crowds at beaches, the same sort of images we saw on the last holiday. What are your concerns? Because you said there's this lag. What are we going to see a couple weeks out, a month out, as a result of people gathering in these big events?
Yeah, it's worrisome. I mean, you look at the president celebrating in front of Mount Rushmore and doing all of the things that our national science advisor, Dr. Fauci, says not to do. So it really feels frustrating, I imagine, for many people to kind of almost see two federal governments. There's the political federal government led by Mr. Trump, and then there's the scientific federal government and the advisory coming from the CDC and Fauci saying to do very different things. That's frustrating, and I think what we're going to see, to answer your question, is a continuation of the rise in terms of hospitalizations, capacity, all those kinds of things are going to continue to happen. We're going to see, in all likelihood, a rise in deaths. You know, that's almost undeniably going to occur. And then, really, what's going to happen is it's going to undulate. It's going to go back and forth, because as states start to shut down, things start to get under control. As they sort of unwind, things go back up. So it's going to go up and down, depending on the policies that are happening at the state and local levels. And of course, we know that the states are 50 different governors and many, many more different municipalities doing different things. And so I think it's going to be a smorgasbord. Some areas are going to be really good. The northeast of the United States is doing quite well. Other areas are going to be on fire. You know, look at Florida is a great example of that. So I think that you're going to see just different populations dealing with COVID very differently.
And Will, mentioning places on fire, I guess you would probably lump Arizona into that category. You're hearing the President of the United States now pushing for schools to reopen in the fall. Let's listen into what President Trump had to say about this.
We want to reopen the schools. Everybody wants it. The moms want it, the dads want it, the kids want it. It's time to do it. You know, our mortality rate is right now at a level that people don't talk about, but it's down tenfold.
The president's saying that the parents want this, and you really can't argue that. I think a lot of parents do want this, but the fact of the matter is coronavirus is not going away. What are some of the complications if we open up the schools after we saw the opening of the economy and some of the issues that have resulted as a result of that? What are we likely to see once the schools reopen?
Well, you know, I think it actually depends on the state that you're talking about. And as you just mentioned, you know, we have 50 different governors that have 50 different policies in place. And to be honest with you, I think there are a number of states, maybe even close to half of the states in the U.S. that could probably responsibly reopen schools later this fall, as long as they have good mitigation measures in place, because they've done a good job controlling the outbreak within their states. There's other states like Arizona where I just don't think it's going to be possible to open schools because we have done so poorly at managing this outbreak from the very beginning. You know, it's one thing to open up schools when you've got good testing, you've got good community containment, your contact tracers can stay up, they can track all the cases, you've got your hospitals in good shape. You know, so we have lots of states like that. There are other states like Arizona, Florida, Texas, others where South Carolina, where we have not been managing the outbreak. Because of that, testing is ineffective because you have enormous demand for testing, and you've got risk in the hospital system. So I think it just really depends on the state. And there are states that have been doing a good job. We have some neighbor states right here. Colorado, New Mexico are two examples of states that have done a really good job containing this virus. And I think this fall, both of those states will be in a position, because they have not fallen so far behind like we have, they'll be in a position to be able to do it.
Well, you spent your career in public health. I want to get your thoughts on mask wearing, because it seems like every day you can look on social media and there's a confrontation at a store or some place of business where somebody says, put on the mask, the other person blows up over it. It's happening a lot here in the United States. And yet people, you know, you go to restaurants back when you could, people weren't smoking at the tables next to you. Years ago they were. People concerned about secondhand smoke, that went away. But putting on masks, somehow there's a disconnect there. Why is that?
I think that's been one of the more troubling things about this because, to be honest, the answer is because at the top of our government, the administration and the president have been sending a message that, that masks are unimportant. And but combined with the fact that at the very beginning of this, remember back in March, there was inconclusive evidence that a face covering was an effective intervention. Now we have very good evidence that it's probably the single most important thing we can do. And by the way, the highest return on investment intervention that we have until we get the vaccine. And so every time I have an opportunity to talk to conservative audiences here in the state of Arizona, I return to that return on investment message, hoping that it resonates with conservatives who should be interested in high return on investment things. The cost of a face covering is negligible. If you don't have one, you can cut up a t-shirt. It's a really effective tool. The more we learn about this virus, the more we learn that it's an airborne spread disease. And for the life of me, I do not understand why we haven't had more enthusiasm about this in Arizona. But it is, and I think honestly, it does come down to the fact that it has become almost a political statement where going around in a retail store or out in public indoors and without a face mask is advertising your politics. And it's really shameful because the damage that this virus is causing in the community is so profound.
Well, Gustavo, let me ask the same question because Bolsonaro says don't wear a mask. He doesn't like it. Are people in Brazil wearing masks?
I think we have the same problem that the U.S. has. It has become a political statement here too. And in here we also have this culture, macho culture, that men would be proud not to protect themselves as a testament that they are stronger than a small virus and that they are true man. So we also have this macho culture that plays into the equation. I'm here in Brasilia right now where the governor is starting to reopen most activities. We do see a lot of people with masks, but there is a 1/3 of people that I have seen on the streets are not wearing masks. In São Paulo, where I live and where I stay most of my time, the problem is even bigger. And even more people are not wearing a mask. It has also to do with cultural level. In Brazil, we have a big disparity in terms of means, in terms of awareness about the virus. We still have 5% of people who believe that the coronavirus doesn't even exist. So that also plays into the equation.
All right. Well, I want to thank all our panelists for joining us. It's been a delightful conversation. Appreciate it. That is it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching.